people suffering from low back pain stop pain quickly, to help them regain mobility, ability to lift, walk, sit, and sleep. And this is important because it allows them to return to walk and play and life they love. Today I'll show you 2 exercises that they're very important for low back pain and sciatica as well. So the first exercise is piriformis stretch. So piriformis stretch is actually stretching hip muscle that's sitting right on the top of sciatica, and that's why it's very, very beneficial. So with the piriformis stretch, you have to actually sit down, keep your core nice and tight, and your spine nice and straight, and then put your heel on your knee, and then apply a little bit of pressure on your knee until you feel your hip muscle stretching. Keep stretching, for 30 seconds or 10 deep breaths. Okay, so stretch on one side and then stretch on the other side, alternate left and right, 3 sets of 30 seconds or 3 sets of 10 deep breaths, and repeat this stretch 2 times a day to relieve the pressure on sciatica. The second exercise that I really love for low back pain and sciatica is hip flexor stretch. Hip flexor is very important because very, very often facilitated, very tight and very short, causing a lot of pressure in low back pain. So if you have a nerve root irritation, that pressure will irritate the nerve root, it will close the space, and the tightness will actually limit your hip range of motion and inhibit core activation. So one of the very important exercises. So there are a few different ways to do this stretch. But in general, I like using a chair or a floor. You put your leg on a chair, keep your core nice and tight, open up your shoulders, step forward, and open up the hip slightly. What I don't want to see is actually belly hanging forward, right? Or arch in the back. So there should not be an arch in the back. It should be very nice and natural. Belly should be nice and tight. Chest open, hip back, stretch in that position, pain-free for 10 deep breaths or 30 seconds. Then stretch on the other side, again for 10 deep breaths for 30 seconds, and alternate left and right 3 times. Repeat the stretch twice. Those 2 exercises are great and they usually help relieve some of the symptoms. However, if they don't help, that means that you have more serious underlying issue and more serious problem. In that case, call my office to schedule a free phone consultation or a free Skype consultation, or just simply schedule an appointment. Thank you very much.